Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Bailey Merzick, Dan's co-host for the day. Today, The Wrap will serve as the perfect forum to discuss quality forums at Michigan Medicine and why these new events are so important.
Now, before we get into that, be sure you go back and get caught up on any episode of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. New episodes debut weekly, can also be found on the Michigan Medicine YouTube channel, and as part of the Headlines Week in Review.
All right, let's dive into our discussion on quality forums with two of our Michigan Medicine team members. First, can the two of you introduce yourselves and explain your roles in the organization?
I'm Dawn Skivars. I'm the program manager for the Quality Forum. Just kind of oversee those events.
And I'm Amy Varecki. I'm a senior project manager in pharmacy innovations and partnerships, and I do a lot of work with the medical group quality.
Excellent. All right, so now we've mentioned quality forums quite a bit already in the first intro here for the show. What are quality forums and why have they been created?
So the quality forum purpose is to spotlight teams in the institution that are advancing quality care, patient care, and we're hoping to just educate people on this great work that's going on and hopefully have, discussions, and maybe some of this work can spread into other areas of the institution.
So if people are interested, when is the forum held and who can attend these forums?
The forum is held bi-monthly, usually on Thursdays, and it's at varying times. Lately, it's been like at noon or 5 o'clock p.m. Anyone can attend. We are looking for people within that are looking to learn about quality improvement work.
So what sort of topics are coming up in the future that either our listeners and viewers will be interested in, or maybe that you're just interested in?
Yeah, good question. We actually have a couple of presentations coming up. Well, first of all, I just want to say Amy's presentation that she did last week was phenomenal. Thank you, Amy. But we do have Dr. Murray and his team, and they're going to be presenting on reducing delays in aortic emergency transfers. And then another one that we have in a few more months is Dr. Taper and team. They're going to be presenting on reducing cirrhosis readmission work.
So I just wanted to add really quick too, we didn't really include this in there, but we usually put the invites in headlines, so you can find it in the events and headlines. So there's many different places you can get to the invite for those that are interested. So let's turn to Amy now. Recently you presented, like Dawn mentioned. So can you give us an overview of the project that you presented on?
Yes, of course. And I want to thank you, Dawn, first, and your team for inviting us to present. I think we were one of the first quality forums. So it was an honor, and it was a really great audience that showed up and had really great feedback and a lot of great questions and some follow-up that I've had since then. So it was a great opportunity. And what I presented on is something we've been working on for years. So I started in the Department of Pharmacy Innovations and Partnerships back in 2016. And one of our main quality focuses is improving blood pressure quality or blood pressure control with our hypertension population. So those patients that have diagnosed hypertension and improving their numbers. So there are national quality benchmarks by HEDIS that we look towards. And the benchmark for blood pressure is 140/90. So our goal, our overarching goal, is to help our patients with hypertension achieve that number or below is what our goal is. And so I sit in this department that houses clinical pharmacists. So we have pharmacists that are housed in each of our ambulatory care, primary care offices. And so there's 14 of those. Each provider has an opportunity to refer patients to a pharmacist for hypertension management. So that includes any medications that patient might be on for their blood pressure control. The pharmacists in our clinics can independently manage those medications, so increase or lower the dosage or add or take off one of those medications according to a protocol that we have set out. They also manage a couple other disease states, diabetes, hyperlipidemia. But for the purposes of my presentation last week, I mainly talked about blood pressure control. So we had some research and data that we pulled back in 2016 to kind of really hone in on the population that we thought would really make a difference and include improving our blood pressure control as a medical group. And what we found was that the patients that we saw in September, in December, so the patients we saw in September that had an out of control blood pressure, and then 3 months later in December still had an out of control blood pressure, and they actually had the same blood pressure. So that means we didn't follow up with them, which our recommended follow-up for elevated blood pressure is 2 to 4 weeks. So when we're checking that 3 months later and they haven't had follow-up, that's not great. So we really wanted to figure out how to identify just those people. And what we did was develop a best practice advisory. So when a patient's being roomed by a medical assistant, they have their blood pressure taken just like any of us that go into a clinic. And this isn't just patients with hypertension. This is anybody who walks in a primary care office and they're going to see their doctor. So they have their blood pressure taken and it's above that 140/90 threshold that I discussed. And so it flags the patient and tells the medical assistant, hey, this blood pressure is elevated, please recheck in 5 minutes. And so a lot of our MAs in the clinics have adopted these little like timers where 5 minutes later they'll go and check on the patient again. And a lot of times it's falsely elevated, that first reading, because the patient's rushing in, they might be stressed about something, they just got done walking across the clinic, and we really want them to be a little bit more rested, have a chance to calm down, get settled in. And so that 5 minutes has really made a difference. Our data in the beginning showed up to 40% of patients at their second blood pressure reading, they came below threshold. So we're really helping, just with that recheck, we're identifying those patients who truly need follow-up. So if they do have a elevated blood pressure at the second reading, then it prompts a referral to see our pharmacist following their visit with their physician or other provider that they're seeing that day. And then I went into some community pharmacy work that we're doing, a partnership with Meijer that we started in 2016 and have expanded to 5 stores that we're partnered with. We have clinically trained pharmacists at Meijer that see our Michigan Medicine primary care patients, regardless of what prescription filling pharmacy that they use. So that's really increased our access for patients to have hypertension management.
That's awesome. So as one of the first to present at, a quality forum, what was sort of the reception like from those who attended? What was that experience like for you? Were you able to learn from them as well?
Yeah, I think it was a really, really great audience. So across the system, and I think I really enjoyed like the questions that I got and follow up, and everyone really gets excited about especially our community pharmacy partnership. We're one of the only ones in the nation that do this type of partnership. And those Meijer pharmacists have full access to our patient charts. They've gone through hypertension management training. So it's really great to hear or see the reception of that program in particular, because it's so unique. And then utilizing clinical pharmacists on our care teams is so important and shown so many great outcomes that it's really, I'm really grateful to be able to present and tell others within our medical group about everything we're doing.
Yeah, so that was a great project that you presented. So looking toward the future, do you have any other plans or, expanding your research or anything like that in the future?
Yeah, we are actually continuing blood pressure control as a main focus measure in quality for the medical group. And so we're really turning our focus back on the workflow adherence to that best practice advisory, making sure that MAs, there's been a lot of like turnover and new MAs. So making sure everybody knows the proper workflow, because we've shown, I said, if they're following that workflow and rechecking, and that patient's getting referred to a pharmacist for appropriate follow-up, we're showing a lot better outcomes And with the COVID pandemic and virtual health, and a lot of those things have really changed the environment since we started this back in 2016, 17. We're really focusing, we built, a place in the medical record system where we could put home blood pressure readings so they count. A lot of patients have a home blood pressure machine now, especially if they have diagnosed hypertension. And so capturing, getting them an appointment, one, to make sure their home blood pressure machine is accurate. And then once we've been able to validate that accuracy, they're able to just, let us know via phone call or sending us a message in the portal what their blood pressure readings. So really expanding the ways that we're integrating the blood pressure readings into our medical record system. And then we're really focused on health equity in the coming year or two. It's a big focus across the medical group for all different quality metrics, but blood pressure specifically affects African Americans and our aging population far worse than it affects any other population. So we're really pulling reports in my chart that have patients who are African American and or of our aging population. And so we can target them first and prioritize them because they are disproportionately affected by higher blood pressure.
All right, well, thank you both, Amy and Dawn, for sharing some information today on Quality Forums. As we talked about earlier, you can find these in the events on headlines if you would like to attend, or we usually do a preview story on them. So before you go away, it's time for the lightning round when we ask our guests 4 quick-fire questions that they haven't seen before. Amy, your March Madness bracket didn't do so well, so we are going to put you in the hot seat. Are you ready to go?
I'm ready.
All right, so Bailey just mentioned March Madness, but this time of year also marks the beginning of baseball season. Are you into baseball? And if not, are there any other sports you do follow closely?
I am into baseball. Go Tigers.
Yes, good answer.
Okay, so spring is about to spring. What is your favorite springtime activity?
My favorite springtime activity is probably running. I'm an avid runner, and so springtime weather allows me to get off the treadmill and out onto the roads.
All right, so we've asked this throughout Women's History Month. Who is one woman that has mentored or played a major role in your success during your career?
During my career, actually my current boss. And so if she's listening to this, I'm not not trying to puck her up, but honestly, I've been with her since 2016, and she's an excellent mentor. She's a very innovative thinker, and she really takes the time to walk through new projects and different visions across the system. And I've really enjoyed a lot of growth since I started working with her, and she's, I think a lot of people across the system recognize her for that as well.
Hey, finally, we are closing out National Nutrition Month. What is one meal that you could eat over and over again and you would never get sick of it?
Oh, goodness. I guess since we just passed St. Patty's Day, I'm Irish, and corned beef and cabbage and Reubens. I've been eating a lot of those. So that's one I could always eat.
Love it. Well, thank you so much, Amy, for playing along and for sharing information on Quality Forums and the work that your team is doing. If you want to learn more about these forums, go to mmheadlines.org. That's mmheadlines.org.
And while you're there, you can check out this week's featured stories. For instance, there was a look at how you can make the most of your valuations as the fiscal year comes to a close, and the organization celebrated the first anniversary of the sepsis team, which is carrying out important work to protect patients at Michigan Medicine. Find all that and more at mmheadlines.org.
All right, Bailey. So we've talked about March Madness a lot, and the Final Four, of course, is coming up this weekend. How into the tournament do you get? Are you a casual observer, a non-observer, or are you basically glued to your TV for 3 straight weeks?
It depends how my bracket's doing. Like right now, I have no teams left, so I don't care as much. But at the beginning, yes, I am glued to the TV because we have a big family bracket tournament. So I have to watch and see where I am in the standings all the time. So what about you?
Yeah, so I'm way into it. First of all, I don't think anyone has any of the teams left. It's been such a weird year. But yeah, I'm basically glued to the TV for 3 straight weeks. I think that is reasonable to say. And I'm always rooting for the underdogs. So I always, I probably don't pick them in the brackets, but I'll just still be sitting there rooting for them. I think that's one of the beauties of the tournament. So I pretty much love it. Now, who's your prediction now to win the championship now that we know the Final Four teams? I'm going with UConn.
Yes, I was going to say UConn as well.
All right. So now everyone in Connecticut can love us.
Or Iowa for the women's.
Yes, Iowa women look amazing. Caitlin Clark is incredible.
Okay, it's time for the weekly trivia contest. This week's question is, which 2 inpatient teams recently earned recognition for their work on sepsis? Once again, which 2 inpatient teams recently earned recognition for their work on sepsis? You can find the answer in this week's headline story, and once you know it, you can send it to headlines@med.umich.edu for the chance to win a prize.
That's all the time we have for this week. Thank you so much to Amy and Dawn for joining us, and thanks, as always, to all of our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.